Hi everybody, thank you so much for joining me today for our FeverAll Hot Topics Facebook Live event. My name is Jolin and I'm a pediatric nurse practitioner and mother of two boys ages 5 and 2 years old. And I'm excited to be here today to talk to you about fever, which is such a huge and hot topic right now, considering we are in the midst of, they say, the worst flu season we've seen in 13 years. Plus the varied colds and other symptoms that are out there right now. So this is the perfect time to get together and talk about fevers. I do find that this is the question that I get the most in the office with my patients. So I'm going to answer some of the most common questions that I get from families and other moms out there first, and then what I'll do is go into the comments section and start answering some of your questions. If for some reason I don't get to your question today, I will definitely answer that within the next 24 hours for you. So I just want to say too that this is just a chat we're having. This is not to replace any medical advice from your healthcare provider. Certainly if your child is sick with a fever or any other symptoms, I advise that you take them to your pediatrician or nurse practitioner. This is not for diagnosis or anything like that. So what's the biggest question I get all the time is, what is a fever? So I want to reassure you that a fever is a good thing. It's the body's response to whatever's going on, an infection, a virus, anything at all. It means your body's working. So when parents call or come in that they're so nervous their child has this fever, I always want to reassure them first that it's a good thing. You want your child to have a fever. That means that the body's working and it's fighting off whatever illness they may have. In general, we consider a fever to be 100.4 or higher. So that's a guide for you to know exactly what a fever is. Another question I get asked often is, how can I tell if my child has a fever? So many times children get very hot running around, or they're bundled up in their snow gear and they feel really hot and people think they have a fever. The best way to know is really look at your child and see how they're feeling. Are they cranky? Are they irritable? Are they uncomfortable? If they're those things and they're also feeling warm to you, it's a good idea to take out a thermometer. Now, the best way to check your temperature is with an oral or a rectal thermometer. There's a lot of thermometers out there, a thermometer and a pacifier, one for the forehead, under the arm, in the ear. And those are all fine, but they don't measure the core temperature and give us the exact idea of what your child's temperature is. So if you're going to invest in a thermometer, invest in an oral or rectal thermometer to give you the most accurate measurement. And just a reminder again that a fever is considered 100.4 degrees Fahrenheit or higher. And a question I get all the time, especially from like millennial moms, is that they're not a fan of giving their children medication with a long list of ingredients, with artificial dyes and flavors and other things additives that we don't really want to give our kids. And I have to say, as a mother myself, I like to give my kids the purest form of absolutely everything. So my favorite medication to give for fever is the FeverAll acetaminophen suppository, because it only has 5 simple ingredients. There's nothing added. It does not have parabens. It has no artificial flavors or colors, no preservatives. And the all-time worst is that high fructose corn syrup, which it does not have at all. So that's really my favorite fever reducer, not only because it's quick and efficient and accurate every single time, but also I love that it's completely pure in nature. Another question I get is, what should people have on hand when there is a fever? I always tell people to have this stuff on hand ahead of time before fever strikes, because for whatever reason, I don't know if you notice this, but fever always strikes in the middle of the night. I'm on call, I get calls all night long about, my child has a fever, it's 3 a.m., it's 2 a.m., it's 5 a.m. What is it about fevers that they strike in the middle of the night? I think they know that we're unprepared and that we're going to panic. So not to panic if you have these certain things on hand. I would definitely have acetaminophen on hand, either the oral or the suppository form of acetaminophen like FeverAll. And something I like to have, our number one thing in the house, is popsicles. I love the ones that are made just of fruit and vegetables, so you know that they're also getting some nourishment in as well. Coconut water is wonderful for a natural electrolyte replenishment. Juice, water, any cool foods or fluids are great to have on hand. And of course, make sure that you have their favorite blanket or stuffed animal clean and ready to go, because when kids are sick, it's the worst and they just want to snuggle and be comforted by their loved ones. At what point should you call your medical provider when your child is sick or have a fever? That's really a gut instinct by the parent. I always say that I see your kids for like 30 minutes a day. You're with them 24/7. So as a parent, you know if something is not right in your gut, you come in or you call. There is no silly question. We are on call 24/7 to take care of you. That's what we do. So please call at any concerning symptom or sign. Having said that, I also don't want people to panic when they see fever. They see a 102, 103 fever, and they call right away, but the kid is running around in the backyard, drinking, eating, and sleeping fine. So use your judgment. If your child's very uncomfortable, if the fever is too high for your comfort level, or any other concerning symptom, give us a call. That's what we're here for. And again, this is not I'm not giving any suggestions to override your pediatrician or healthcare provider. You're going to want to stick with them and call them for any questions at all. For infants under 3 months, it's very important to know that if they have fever of 100.4 or higher, you have to call right away even if they seem fine. Okay, so that's just an important thing. Anybody else over 3 months, you're okay. So I'm starting to see some great questions come in the comments section, so I want to make sure to get to some of those. The first one is, it's incredibly difficult to give my child liquid medicine when they're sick. They refuse it or spit it out, and then I don't know how much they've actually ingested. What can I do differently? This is a common concern for most parents. A lot of children have a hard time taking oral medicine. So the best thing to do is, again, what I love is to use the FeverAll acetaminophen suppository, because it's dosed for you. You don't have to measure it out. It's simple, it's small, it's a suppository, it has no additional ingredients, and you can just give it to your child and know that they're going to get their fever is going to be reduced. The medicine is in, there's no other concern. Because a lot of times what happens is they spit it out, or I've even had, like my kids had the stomach flu around Christmas time. There was no way I could get anything in them, you know, let alone fever medicine. So I was grateful to have FeverAll on hand. I could reduce their fever right away with that. So it's a go-to medicine for spitting, for kids that spit their medicine or who are vomiting. What's the best way to avoid getting sick? Hand washing. Hand washing is hands down the best way to avoid getting sick. They say to wash for 20 to 30 seconds. What I tell my kids and the kids in my practice is wash and sing happy birthday 2 times. So my kids sit at the kitchen sink or the bathroom sink and they sing happy birthday to all the people in our family, and that's when you know they've done an effective job of washing. And remember, it's not just sprinkling water on the hand. Really get that soap and water is the best thing. There are concerns about the antibacterial sanitizers that have additional stuff that are really not healthy for kids. Stick with soap and water. The other ways to stay healthy are to get good rest. Sleep is absolutely medicine. Good sleep and eat nourishing foods and stay hydrated. What is a good thermometer? That's a question I was just talking about before. That's a common question I get. You want to get a rectal thermometer or an oral thermometer. Most of those thermometers do both. They serve both functions to take rectal and oral. Infants under the age of 2, I definitely recommend the rectal thermometer. The oral thermometers, they really can't hold it under their tongue accurately until they're about 5 or 6 years of age. So anyone under that age really should have the rectal thermometer. What is the best way to reduce my child's fever? So the best way is to undress them, put them in something light and comfortable. You can also put them in a tepid warm bath. Ice packs to the groin area. Behind the neck is fine in other areas, but to the groin takes that fever down very fast. And obviously using a fever reducer like acetaminophen, either the oral or the FeverAll suppository as well. Those are both wonderful ways to reduce fever as well. Do kids get fevers from teething? Yes, they do. And interestingly enough, some people think that it's just a low-grade fever, that they're just cranky. I just had a kid in the office the other day who had a 102 fever. There was no other symptom except that he was gumming a lot and I felt his tooth erupting. So he had 102, and which is considered high. It's scary to parents to see 102. But he was gumming on his little teething ring and he was perfectly fine. So again, it's not the number. Don't be terrified by the number. How does your child look? That is the barometer for us as well. How do you clear a nose without blowing? Good questions. These are some great questions. I love to use a humidifier in the room. I have humidifiers in our living space and in the children's room and my bedroom. That's a great way to humidify the air, because it's also very dry with the dry heat and everything that's running in our cold homes right now. So a humidifier is a great way. Another wonderful way is to just use saline. Saline is salt water. You can use drops in the nose. For younger babies and younger children, like under the age of 2, you can use the little saline drops and then use the suction aspirators. They're called a bulb syringe. They're kind of blue with a little point on the edge. And you can just aspirate out the mucus after you use the saline drops. I recommend doing that before they go to bed or nap. And if you're breastfeeding or bottle feeding, you want to do it before that as well, so that they have room to breathe when their mouth is filled with milk. Anything to boost the kid's immune system this season. Back to good old fresh air. My kids are out in the freezing cold. We walk to school every single day. They are out for at least 20 to 30 minutes every single day. Fresh air is amazing and important for your immune system. Eating healthy foods, fruits and vegetables, avoiding processed foods, foods high in sugar you want to avoid. Good old vitamin C is great, so if you can get that from the healthy foods, that's ideal. Washing your hands. It's the #1 way to prevent yourself from getting sick. Wash your hands well, and don't forget to sing happy birthday, because otherwise, if you don't do that twice, you're not washing them long enough and it's not effective enough. A humidifier. Do you add cleaning solution? So for the humidifier, I just put in the water for the kids that it comes with. I think most of them require distilled water. I like to just use that. I don't add anything in it that the manufacturer doesn't say to. Some people use essential oils. I happen to also, and I will have those kind of diffusing in the air as well, along with the humidification. That's another way to purify the air and keep healthy this flu season. And the question just came in, the next one. Do oil diffusers help for sickness? Yes, they do. Again, go by the guide of your provider or someone who's licensed in the area. I'm a holistic nurse practitioner, so I've studied it. You're going to want to look for people who are licensed to give you the advice about oils. But absolutely, they're great. I have them running 24/7 in this household. And there's also a list of ones that are healthy for children. So again, contact your healthcare provider or someone licensed in aromatherapy to give you that information. But yes, absolutely, they're helpful. Is water best to avoid dehydration when sick? Water's excellent. It's the simplest, most purest form to keep you hydrated. So definitely water. I happen to like it better than juices and juice products just because those are high in sugar, and sugar decreases your immune system and gets you down, so it's kind of a catch-22. I love water, and I love coconut water. Coconut water has all of the electrolytes that your body needs to replenish when you're sick. So it has natural sugar, it has potassium, it has salt, it has all of those electrolytes that you would miss when you have a fever, when you're vomiting, things like that. So water and coconut water are my go-to. Do kids lose interest in foods when they're sick, and is that normal? That's an awesome question. Thank you for whoever wrote that in. They do. And it's actually a biologic reason why. When your child has a fever or is sick, the blood flow goes to the area of the body that's sick. So if you ever notice when your child has a fever, their heart beats very fast and they breathe very fast. And that's because the blood flow from the body is going to their core to help that fever kick out the flu or virus that they're ill with. So you might notice too that their hands and feet become a little cool or clammy when they have a high fever, and that's absolutely normal. So what it does is the blood goes away from the stomach, and the cue to be hungry is turned off because the blood flow is not going as much to that area anymore. So kids typically don't want to eat when they're sick, which is fine. They don't need to eat anything, to be honest with you. The most important thing always is that they stay hydrated. So push those fluids. If you have to do 1 teaspoon every 5 minutes by mouth just to make sure they keep the fluids in, do that. But anything that you can get the fluids in is the most important. Don't worry about the food. If for some reason they're not taking the fluids and they're having a fever, and even worse, they're vomiting, you want to call your healthcare provider, because it's most important that they get fluids. Next question is, what's the second choice to water if your kids don't like water? So you can do half juice and half water. That would cut down the sugar a little bit for you. Any of the natural juices, if you have a juicer even, and we're fresh pressing juice from fruits and vegetables, that's ideal. My kids drink those all the time. I love smoothies. So fruits and vegetables in the smoothie. Some kids even put a little ice cream in there to flavor it up. You can throw a little natural apple juice or something with or orange juice with no added sugar. Any of the juices that have no added sugar are good. Grape juice is also wonderful. So those are ways to get in the fluids, and you can just dilute it down a little bit with a little water, or coconut water would work too. How should I dress my child with a fever? So many times I have kids come in and their temperature is like 105, and they come in and they are bundled. They're like in snowsuits or bunting. They have hats and gloves and all of this. What you want to do is take down a layer, and you just want them to be in regular clothes. Nothing crazy. You don't want them in a sweater. It's an old myth that the cold air is what makes you get sick. It's the viruses during this season, during the cold season, that makes you sick. It's not cold air. So when my mom used to tell me to put my pom-pom hat on to walk to school, and I was mortified and embarrassed, and she would say, put it on or you're going to get sick, she actually wasn't right. So don't worry about that. That's not what makes them sick. So you want to dress them in something that's comfortable, a light pair of pajamas, something that's comfortable and light. You don't want to strip them down either, because when their fever reduces, they're going to shiver and shake because they're cold. So just something light, cool, and comfortable. Best spot to take a temperature. Thank you for writing that in, because I love to reinforce this, that the best place to take a temperature, ages 5 or 6, or any age that they can keep the thermometer under their tongue, is fine. Rectal is obviously the most accurate form, because it's measuring at the body's core temperature. So rectal or oral thermometer. Under the age of 2, I really say even 4. I mean, he's now 6, almost 6, but he was not able to hold a thermometer under his tongue even last year. So use that as your gauge, and otherwise take rectal. What should I not give my child with a fever? So things you don't want to give is, you don't want to give them tons of sugar. You don't want to give them tons of processed food. Obviously, if it's the only thing they'll drink, it's better than nothing. Let them drink what they want. But you don't want to throw a million medications at them. Again, the fever is the body's way of fighting the virus or flu or illness for you. So it's a wonderful thing. If your child has a fever and they're running around playing, don't do anything. My older one runs around and he's fine with like a pretty high temperature, and he's acting fine. My little guy has a little fever, and I have to give him the FeverAll suppository because he's miserable. So use your gauge as a parent or caregiver. What's in your gut, like I said before. I trust parents' guts over everything. So give them whatever they're comfortable eating or drinking, and don't push anything more on them. Can I give protein shakes? That's a good question. Obviously, natural foods are the best. Whole grain, whole fruits, vegetables are obviously the best. You can give a supplement of a protein shake once in a while. It's safe to do that. Certainly, I wouldn't give the whole scoop because many of them have quite a bit of protein, and we don't want to give too much. but there are actually many brands are very, very good. So if you speak to your child's nurse practitioner or pediatrician, they can recommend certain brands to you. There are some that just have fruits and vegetables that you can add a scoop in. I've definitely done that. My kids do like the protein shakes, so I add a lot of natural fruits and vegetables to them, and then I'll give them a little sprinkle in there as well to flavor it for them. You absolutely can, but again, that's a question for your healthcare provider on which brand to use and how much. Should I avoid polyester clothing because it traps heat? Absolutely. When I was talking just about that other question earlier about what to dress your child in, I love cotton and anything that's light and loose fitting. Polyester does trap heat and can make them a little itchy and uncomfortable. So I would go more towards cotton and light fitting, airy, breathable clothes or pajamas. How do you treat a cold? That's a great question. You know, there's all this hype right now about the flu, and nobody's talking about the dozens of other viruses that cause the common cold that also cause kids to get very, very sick. So how do you treat a cold? Again, the best medicine is eating healthy foods, hand washing, and getting outside, getting some fresh air. And then a humidifier is a great way to get the nasal passages open. I would have a humidifier running at all times. If you don't have a humidifier, you can turn your shower or bathtub on really, really hot, close all the windows and doors, and have your child sit with a coloring book or, you know, read a book on the floor of the bathroom while it's nice and steamy. That will do the exact same, give you the exact same effect. So a humidifier is a great idea also. And just to touch on again, the saline drops that you can put in their nose and just suction it out. Now my older one, who I mentioned is 5, almost 6, there's no way he's going to let me suction his nose out. So I'll put the saline drops in there. I'll use a little lubricant on their nostrils to keep things humidified. I do that in the morning and at night to keep them humidified and just get them to blow that nose really well. Are flushed cheeks a sign of a fever or just tired and hot? Awesome questions coming in today, guys. So it could be both. Some kids running around outside in the cold come in with really flushed red cheeks. Not to worry. Always go by your gauge. How's your child acting? If they're flushed and feel hot and look miserable, take their temperature. There's also kids that have really sensitive skin. Some kids with eczema too will appear very flushed when they're not feverish or febrile at all. So again, just go by that gauge, and if you're concerned, always check the temperature, again with an oral or rectal thermometer. Is elderberry worth the hype? Good question. So I am a holistic nurse practitioner, like I said. I make my own elderberry syrup, and the little one will drink it. My older one poo-poos it now, but he does take an elderberry chew that, of course, has no added sugar to it. Elderberry has been proven. There are actual clinical studies that prove that it can be effective as a preventative precaution, but also for general viruses, cold symptoms. I think it works great. It's all natural, so anything you can do to boost your child's immune system that's all natural and not harmful, why not try it? Again, you know, sticking with all natural for fever reducers, try and avoid the ones that have the artificial dyes, the colors, the parabens, the preservatives, and stick with brands like the FeverAll acetaminophen suppository that has literally 5 ingredients that are just necessary for it and have nothing else added in. So stick with the pure and healthy and natural. Can a vaporizer help, or is it bad for a sick child? A vaporizer is the same thing as a humidifier. Some of them add in a little breathing assistance. It's like a little fluid or drops of something that they sell with it that you can put in it. It's perfectly fine and safe, and I do find that it helps the child open up. Like I said before, I have a humidifier, which is the same thing as a vaporizer. It keeps the room nice and steamy and moist for them so that they don't get too clogged up. And I also have some essential oils to give that same effect to kind of open them up a little bit. Are FeverAll suppositories small? Yes, in fact, I have some here to show you because I think sometimes people get nervous about giving a suppository to a child and they don't realize how simple and effective it is. I'm going to open one up to show you how tiny they are. You're not going to believe it, actually. Most suppositories that are given are larger. These are so tiny, and they slip right in for these kids. I don't even know if you can see it. It's the size of my fingernail. It's literally the tiniest little thing. I'm going to hold it up. Can you see it? Maybe give a thumbs up or a like or something if you can see it. Awesome. It's so tiny that when you put the little lubricant on it to put it in your child's bottom, it literally slips right in. I mean, you literally put it there and it goes right in. You don't have to push too far. It's the easiest thing you can imagine, and it's so effective, and here's your dose. So you're in the middle of the night, your child has a 104 fever, they're flushed, they're screaming, they're uncomfortable, they have pain, maybe from an ear infection, and you're like, I don't know what I gave last. I don't want to give them this cherry syrup that has all this junk in it. Here it is in the dose for you. Open that diaper, stick it right in, their fever comes down, nothing added, no preservatives, no parabens, no colored dyes, nothing. It's 2 seconds, it's easy and so simple. This is on hand at all times at my house. What can you do to comfort a sick child? Oh, it's the worst when they're sick. I really think there's like nothing sadder than a sick child, although I also secretly love it when they're a little down in the dumps, because my kids get very clingy and want to snuggle, and I love to do that. So I do think having like their favorite item on hand, be it like a little blanket or a stuffed animal, their favorite drink or treat in the house like a popsicle, something that makes them feel comfortable, and a lot of close-knit hugging and cuddling is always helpful. It's actually a phenomenon with babies when they're breastfeeding, that they want to breastfeed more and more when they're sick or have a fever. And the interesting thing is, with the biology of it, is the breast milk, the breast can pick up the child's saliva and pick up what virus they have and what the mother's immune system needs to make in the breast milk for the child to get. So the child is breastfeeding and getting all of that natural immunity from the mom, and they're close to the mom, skin to skin as much as possible, because the mom's immunity can pass to them through the breast milk. So it's the most incredible thing, the way the body works. So close snuggles all day long for those kids. So I think there's a few more questions coming in. I want to make sure that you know that I'm going to get to them. We have to close up now. But I just want to reiterate that I will get to those questions over in the next 24 hours, so please post them for me. And remind you again to always go to your healthcare provider if you have any questions about fever or illness. That's what they're there for. Don't hesitate to call. That's what we're here for. We came into this field to love and care for your children like you do, so don't hesitate to call. And thank you again so much for joining us, and here's to a healthy, happy flu season. Take care.